That is the price tag on the kid's life.
Yeah.
You come up with 3 lakh rupees, you can save your child. You don't have 3 lakh rupees, you will lose your child. We are genetically 3 times more vulnerable for heart attack than Caucasians. Mukesh, we forget the power of purpose. It's not me. It is what I stand for. There should be no difference between the poorest man and the wealthiest man when it comes to the question of falling sick and seeking care. The aim was to do first 100 heart surgeries without any mortality.
Early on in career, you got to treat Mother Teresa.
About 1.5 million farmers had different types of surgeries. All this happened by 5 rupees per month. This is the power of India. AI will have a massive impact. Now, it will not replace doctors, but it will dramatically improve the productivity of the doctors. When we make healthcare policies, we shouldn't look at what is the need for India. We should look at the global requirement. I have no doubt that India will become the first country in the world to dissociate healthcare from wealth.
Dr. Shetty, welcome to SparX. Really looking forward to this conversation. I was reading about your background and how you started Narayana and so on, and how you got into medical profession. So one of the first things that stands out is very early on in career, you got to treat Mother Teresa. That must have been quite an experience, and probably can imagine little unnerving as well, right? To start to treat somebody of that stature.
Yeah, it was a kind of a dramatic turn in my life, I guess. Before I met Mother, I never thought somebody with flesh and blood like me can't be like God. But with her, that's the only time in my life I thought somebody with flesh and blood can be God, like God. Yeah. That dramatically transformed my view of life about power of simplicity. Any complex problem, you can approach it with a very simplistic approach. And her, one of the very famous teaching is, hands that serve are more sacred than the lips that pray. Yeah. These are the few things I learned with my few years of interaction. There's been a huge influence in my life, yes.
Yeah, I can only imagine. Yeah, I think we only read about her in books and so on, but you being interacting, with her and learning from her. Yeah. So you said you were treating her for a number of years.
Yeah, she had heart attack. So at that time, I was working in Calcutta. And those days, there are no mobile phones to speak of. So there was a telephone call which came to my OT saying that somebody wants you to make a home visit. And they didn't reveal the name. So I said, I'm a heart surgeon and I don't make home visits. Then the caller said, if you make a home visit, it may change your life. I said, that's interesting. Yeah. And when I approached that address, then I realized I was relatively new to Calcutta at that time. Yeah.
That sounds like a leap of faith. Someone says, home visit will change your life without doing anything. You are not scared or, No. Yeah. And I think even your work in Calcutta also in somewhat almost didn't happen. I was reading the story about, how the Birla Hospital, you got the name from
Exactly.
and you almost didn't go there.
Life is a very strange weaving of various coincidences,
right,
which finally shapes your life. Yeah.
One other thing, reading your background, you come from very modest, family. You're, I think, 8th out of 9, siblings, which must be a large family and so on. And I think you started thinking about becoming a heart surgeon fairly early in your career or even in your schooling days. Where did the inspiration come from?
It's very interesting in the sense, when I was in, I think, 5th or 6th standard, our teacher came to our class and announced that today somebody in South Africa did the heart transplant. She removed the heart of a person who's dead and put it on somebody who's with a weak heart, and the man walked out of the hospital. It's a very dramatic way you put it. It wasn't that case. But that somehow something happened in my mind that I should do that when I grow up. Then I realized to become a heart surgeon, first you should become a doctor.
Yeah.
And I said, okay, no problem. I don't mind becoming a doctor. And many things happen when you are the eighth of the 9 children.
Yeah.
When you grow up, your parents fall sick. And in your life, doctor becomes like a god because he is the only person who can save your parents. So many events happen which consistently, they enforced my belief that I should become a doctor. I should do something. Yeah.
Yeah, it's incredible how childhood experiences can shape pretty much our entire life and destiny, right? It's who we expose. Just one news, which might have been, as you're saying, maybe you exaggerated
Exactly.
but it planted the seed of,
Once it is etched in your mind as a kid, it has a very, very powerful force. A lot of things happen. Like when I was a kid growing up, in South India, when kids are born, the first thing the father does is to run to an astrologer to make a horoscope. And when my father did the same thing, when I was growing up, he started telling me that, your horoscope is such that you will become very famous. But more than anything else, he narrated a very strange, like a statement that those who choose to work with me as my colleagues, they will be condemned to work with me lifelong. So many times people leave me, but most of them come back.
Right. And I was reading, I think, and you've talked in some of your interviews as well, like a lot of people here and I have, because they believe so deeply in the purpose that the hospital has. They are working here for decades and, feel like this is a bigger calling than just a job and profession. So in some ways, maybe the astrologer was right. You ended up exactly how they do.
Yeah, Mukesh, we forget the power of purpose. It's not me.
Yeah.
It is what I stand for. I think they are following the purpose rather than me.
Yeah.
We grossly underestimate the power of purpose.
No, I can totally imagine. Yeah, I think in my own entrepreneurial career, I've seen, there's a Jim Collins book called Good to Great. And one of the things, I picked up from that book very early in my career, this whole, power of purpose, how this big organization is built around that, real belief in the purpose. My own small way, I've tried to do that in the venture I've been part of, but it also, truly living the purpose and truly, meaning it. And it also takes, a lot of effort on an ongoing basis. That reminds me of the purpose of Narayana Health when you started, this whole idea of affordable healthcare for all. Now that's something, we think of that as a slogan that everybody says, of course, everybody wants affordable healthcare for all, but there is a huge disparity in the overall how the healthcare system, pretty much anywhere in the world, etc. But you have really made a difference in that. Just talk to me about, your initial conviction of trying to put together an organization which is going to build world-class healthcare, irrespective of people's ability to pay. That sounds, almost not doable, but obviously you've done it.
Thank you. Thanks.
What was that? How did you, arrive at that? And also what gave you conviction that it can be made to work?
See, most Indians don't realize how expensive healthcare is outside India. I left England in 1989, and the first patient I did the bypass grafting paid 1,60,000 rupees for a heart operation. 36 years ago.
India.
In India. In Calcutta, first patient paid 1,60,000 rupees. Today we are doing the same operation for the same amount or even less. Tell me what was costing 1,60,000 rupees 36 years ago is costing the same amount today, right? This was possible because people like us believed that it is possible and it has to be done. And many, many things happened over a period of time. once again, it's again the power of purpose. And also the country has evolved so much in the last 36 years. Yeah, that also made a huge difference. The entire industry woke up. Everything started getting manufactured in India. People paying capacity also increased. So essentially, many, many things happened, but it is unthinkable that what was costing 36 years ago is costing less.
No, absolutely. There is, I mean, if we just factor inflation, probably in real rupee terms is probably 1/10 of, the equivalent sum, which is absolutely incredible.
Yes.
Yeah. It's, and you were clear when you were founding Narayana Health that you really want to build a hospital which will going to try to bring down the costs as low as possible so that affordability is more mainstream.
See, when I was growing up, most of my friends and classmates are working class people.
Yeah.
So essentially, you look at life with a different prism compared to the children who are born in very affluent families, and you understand what hardship is, what pain is. Then you're in a position to make a difference.
Right.
Then you choose to make a difference, and then you realize it is working. Yeah. See, it's at a very early stage, I realized that if you go after money, it may not come.
Yeah.
But generally, money comes as a byproduct.
Right.
The purpose of life is not money, but without money, the money is like oxygen.
Yeah.
Without oxygen, you can't live for few minutes.
Right.
But without but you don't you don't feel the difference.
Right. Yeah, and I think it's also not fun or fulfilling to work for money when your only motive or driver is that you are trying to make money. But if you do great things, usually money automatically follows. Anyway, I want to ask you also about this journey of becoming, you are world-renowned heart surgeon. I don't know how many surgeries you must have done by now. You have like a rough account.
After 15,000-20,000, you just forget after that.
15,000-20,000, probably more. Yeah, a lot more than that, I guess. What was the journey in the early days to, becoming a heart surgeon? And in those days, in 70s, 80s, India had all kind of challenges. We didn't have access to any kind of technology. Even probably information flow was limited, access to training, etc. What was your journey of, acquiring mastery in a very hard skill of a very high stakes game? The patient is in a critical situation when you are operating on the heart, trying to fix something. Just what was your journey of, starting your first surgery to getting to a point where you felt, really and you had some sense of mastery?
Early stage of my career, when I was becoming a doctor, I realized that to really learn cardiac surgery, I needed to go abroad. So I chose to go to England, mainly because at that time in India, there was hardly any large-scale program to train doctors. Yeah. That's something which really made a difference. I was very lucky. I think I have been very, very lucky in my life, Mukesh, more than anything else. I wasn't one of the brightest kids in the school. I wasn't one of those, the athletic people who excelled in all kinds of things. I was like regular kid, but I was lucky. I landed in the right place. I had the right bosses.
Yeah.
One after another, I landed at the hospital called Guy's Hospital in London, which was the premier cardiothoracic surgical institute in Europe.
Yeah.
So I had a good training and I came back. And I never thought I will land in Calcutta, but it so happened I landed there. I think that made a huge difference, landing in Calcutta. Right. These are all strange coincidences. Because if I came to Bangalore, maybe I wouldn't have reached the level I reached, because I worked in Calcutta in Eastern India for 7 years. So I realized there was, at that time, cardiac surgery was in infantile stage across the country.
Yeah.
So I could, the aim was to do first 100 heart surgeries without any mortality. And I didn't go home for 2 years. Yeah, I was living in the hospital. And my wife used to come with the 2 kids and the lunch box, and I used to eat in. So it was hard. There was no all these comforts, and we were not blessed in having so much of resources. So, but it worked well in the end. Yeah, as I said, once the purpose is to make things, available to everyone, a lot of things happen, a lot of unknown forces come together.
See, in retrospect, someone anyone looks at, what the impact you have created and what you have achieved, it's obviously extremely inspiring. But going back to the 90s, doing those 7 years with basically almost no privilege or comfort, and just honing your craft by doing those surgeries again and again and again with limited resources, right? That's a very critical part and often probably understated part of building a career, building a name and mastery in some area, right? It's just where today we are somewhat or to get somewhere very fast, and you miss out that 10-15 years of apprenticeship one needs to do. I think I'm almost similar, in a very different arena. I was in Silicon Valley, in most of my 20s, and I worked for a number of startups which failed. And as a result, career was looking pretty bad by the time I was 30. But I learned so much about startup, journey, life cycle, etc. So that is an absolutely non-glamorous part of, journey, but it prepared me for, what was to come later on.
Yes.
Just again, going back to, early days of Narayana Health, as I was reading, the choices you were making, so all very pioneering in its for its time. I think you had this scheme that you worked with the government of Karnataka for
Yeshashwini,
5 rupees per month for getting a basically effectively health insurance, where your all kind of surgery will be covered. That, how did that come about? That sounds like so insane.
It's when I was a kid growing up in a small town, Syndicate Bank had a program called Pygmy. Pygmy collection is, there are Pygmy agents who go from one house to the other. They collect 50 paisa, 1 rupee, 2 rupees from every housewife. And at the end of the year, it used to be a significant amount. So I used to ask my dad, with 50 paisa, 25 paisa, what is going to do? Then he said, that is how money is. You collect from large number of people. Those banks can do a lot of things. So that's the time I realized the power of small amount of money.
Right.
And around 3 years after we started the hospital, about 23 years ago, I think, there was drought in the state of Karnataka for consecutive 3 years. Farmers lost the capacity to buy healthcare. So my friends who are running hospitals in different parts of the state, they used to discuss with me saying that, look, OT is lying empty, patients don't have the money to pay. Those days, there was nothing like a government schemes. So one day I called all my friends. I told them, okay, let's start a health insurance only for surgeries. We'll approach the government. But one condition, they can only charge what it costs. Because right now, the entire infrastructure is lying idle. They all agreed. And we brought together 600 hospitals in state of Karnataka. Then we went to the government. Government agreed to become an insurance. They agreed to become a reinsurer in case we go broke. But they took over the scheme. That is the greatest thing. They owned the scheme. And we were the healthcare providers. And we ran the insurance for about 12 or 13 years. We had 4.5 million farmers paying 5 rupees per month.
Amazing.
And we networked with 600 hospitals. And when we finished the scheme, about 1.5 million farmers had different types of surgeries. And nearly 1.5 lakh farmers had a heart procedure.
Wow.
All this happened by 5 rupees per month. This is the power of India. We have a unique ability to do amazing things. I'll just give you one comparison, Mukesh. We run hospitals in Cayman Island. We have 2 hospitals there. It's one of the richest countries in the world. Significant number of people living in Cayman Island do not have data in their mobile phone. They can't afford it. It is too expensive. In India, beggars also have the data in their phone. Why? Only because of our population.
Mm-hmm.
As we have more number of people to share the cost, all these expensive services become extremely affordable.
And that's very powerful. I think at some level, now 1.45 billion people.
Oh yeah, that is our asset.
That is really as an asset. In the past, we used to think, that's
It's a liability,
right? But seeing that as an asset because they're all, capable human being with aspirations. And I think this is quite instructive. I'm, thinking about, the 20 years ago, you and, with, other colleagues creating the scheme and making, something very important that, so if you have a heart condition, you need to obviously get operated on. You can't afford it just by paying 5 rupees a month. You were able to create a program. I think for entrepreneurs of today, so it's a big lesson. A lot of, again, the easy thing to do is target the rich people in the country.
Exactly.
Build a product and service, and we know they can afford and how to target them and all of that. But you miss out on that because even today, number of rich people run out, after you first, 10 million families or something, the income start to drop pretty fast. So I think it's a great example for people to really think. Now I think I'm forgetting, who was this business professor from Harvard, Indian, the person of
Prahlad, C.K.
Prahlad. He is, fortune at the bottom of the pyramid, right?
But
This is a ultimate example of, creating, not with the intention of making fortune in this case, but still you're kind of showing the power of collective and what it can do.
We started a health insurance, Mukesh. Recently, around 6 months ago, we got the license to be a health insurance company.
Yeah.
The idea of us becoming a health insurance company is based on covering working class families who earn about 20,000 to 60,000 rupees per month. They should be covered for any type of surgeries up to 1 crore rupees. There should be no difference between the poorest man and the wealthiest man when it comes to the question of falling sick and seeking care. You can have disparity in conveniences. You may not have money to build a house or a car or all the comforts. But when you are in pain, you shouldn't suffer.
Right.
So the strategy is that they should pay 10,000 rupees per year. And entire family should be covered for any type of surgery up to 1 crore rupees. Now, what is the rationale of 10,000 rupees? When I started my career 36 years ago, when poor people came, they had hardly any money and they were only begging to save their life. Today, a typical patient of mine, they generally come from Eastern India. They sit on the chair with the baby on the lap, and I examine the kid and I tell the mother that your baby requires a heart operation. She has only one question. That is, how much it is going to cost. If I tell her that it's going to cost 3 lakh rupees, which she doesn't have, that is the price tag on the kid's life.
Yeah.
You come up with 3 lakh rupees, you can save your child. You don't have 3 lakh rupees, you will lose your child. This is what I do from morning till evening, putting price tag on human life. This is what every doctor does in most of the developing countries, from morning till evening, putting price tag on human life. There is something seriously wrong. How can we call ourselves as a civilized society when you officially allow people like us to put a price tag on human life? This is the tragedy part of it. But look at the brighter part of it. Today, that lady, she cries, she touches my feet and, begs. And it's very, actually before you came, I think some of your colleagues would have seen how they plead to save their life. It was very humiliating. But before they leave my office, all of them, today they will say, "Ami 1 lakh dete pari." I can give you 1 lakh rupees. This lady who comes from a slum is willing to give 1 lakh rupees to save her child's life. That made me to think, if I have a health insurance with a premium of 10,000 rupees per year to cover an entire family for all types of surgeries, this lady today will have enough money to cover her family for all types of surgery for the next 10 years.
Yeah.
But she can't create that insurance. I can create.
Yeah. Mm-hmm.
This is what will change the country.
Yeah.
This is what will make things dramatically different.
Yeah.
We always look at the future as an extension of the past. It is different.
Yeah.
Because the tools what we have. Today I'm empowered with the license to start a health insurance. I never thought I will ever get the license, right? Today government policies have changed. They made people like us to have an insurance company.
That's incredible. I think, and this also brings I think there's always been this whole conflict between, the service provider and the payer, and there's a tension, which, all the models like HMOs in West, have at least the people who run HMOs, or in Europe also, very heavy government sponsored, health programs. But this looks like a pretty significant step in the right direction where, marquee hospital like yourself can now bundle insurance also along with the hospital services and, decide, and with 10,000 rupees a year for the whole family is extremely affordable. Nearly everyone in the country is able to afford. And then beyond that, I think there's a Ayushman Bharat as well, which is covering, people who are not even making 20,000 rupees a year. So I think we have a shot at making progress towards where everyone is covered in some way.
Yes.
Yeah.
I have no doubt that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare citizens will enjoy. And that will happen within 10 years. I have no doubt about it.
That's very inspiring and powerful, but also very ambitious, Dr. Shetty, to get to a point, because today there are a lot of, disparity and people don't have access and so on. So maybe say more about, where does your conviction within 10 years, everyone will be covered one way or other?
It will happen.
Yeah.
It will happen. See, today in healthcare, there are three important stakeholders. That is hospitals, health insurance companies, and the patients. Hospitals don't trust the health insurance company. Health insurance company do not trust the hospitals. And the patient doesn't trust both parties. And those two parties don't trust the patient.
Right.
So you have three stakeholders who don't trust each other. But when the hospital becomes a health insurance company, everything changes. Today, when I tell a patient that you need a bypass grafting, first thing what goes to the patient mind is it really required?
Yeah.
Right? Whereas when I become a health insurance company and then I tell the patient he needs surgery, there is no conflict because I'm going to pay for it.
Yeah.
Then the relationship changes. When the service provider and the customer, when their interest is aligned, always magic happens in that industry.
And Dr. Shetty, from, as the industry transforms itself, new kind of products and services will come into play. What is the role for entrepreneurs in this? What are the innovation opportunity for a young upstart to somehow become part of the, this evolving healthcare ecosystem in the country?
See, every aspect of healthcare delivery will undergo change. Starting from, as a young medical student, we were talking about prevention of disease. That was relevant when infectious diseases were the big problem. At those days, malaria, TB, smallpox, chickenpox, you name it, it was rampant. Today, infectious diseases are all virtually, I wouldn't say eradicated, they're not that important. Today, it is the lifestyle diseases and degenerative diseases like heart disease, cancer, and all the other diseases. How do you prevent cancer? How do you prevent heart disease? It's very hard. But you can detect it early. So the entire healthcare of the future will be driven towards everyone every year will go for a checkup. Their blood test is done, echo, ultrasound, all the scans, everything is done. It will be done by a new model of entrepreneurs delivering different type of healthcare. so that everyone will know the status of the health every year. Now, why this is important? Because today, by 6 o'clock, few thousand people in India would have had heart attack and few thousand people would have died.
It's very sobering.
Today in India, by 6 o'clock, few thousand people will be told that you have advanced cancer for which there is no cure. You're going to die. Just go back 365 days. If all these people went for some blood test and some simple scans, none of them would have died due to heart attack because they all the heart blockages would have been diagnosed, they would have been the right treatment. None of those people would be diagnosed with end-stage cancer. It will be early-stage cancer, and early-stage cancer can be cured. All they needed to do was to go for a preventive checkup. Because people must get the message that how fit they feel has nothing to do with how fit they are.
Right.
If you want to, you may climb Mount Everest 3 times in a month. But if you want me to tell you that you are a fit person, I want to see the data. This is the way healthcare is. And in that, entrepreneurs can come up with different models and they can do amazing things.
That's very powerful. I think good message for both entrepreneurs as well as anyone listening to this should take preventive healthcare quite seriously. It takes only a few hours to get a preventive health checkup done, and you can solve for so many downstream problems, which can be quite bad, if it goes undetected for a long period of time. In fact, Narayana, you have also pioneered, I think, new way of screening.
Yes.
And I'm yet to check it out, but I heard good things about it.
Yes,
and,
you should go there. Yes, it's in Prestige Tech Park.
Right.
Yes.
And the thought process is to make this process really
in
fast.
60 minutes, we want to screen your whole body and give you the certificate.
That's amazing. So just 60 minutes a year, if one can invest, it's a different type of insurance. If there's something wrong, it can be easily treated. If not, then you live happily for next 1 year and just. But still, I would imagine the penetration of health screening in the country is still probably very low.
It's predominantly because, as I said, when somebody feels good, when somebody feels healthy, they feel they are really healthy. But not necessarily. When you go through every time you always hear of people during marathon or a treadmill, somebody is jumping up and down and somebody collapses. All those people, 1 year earlier or 10 years earlier, if they had a CT scan of the heart, that would have been detected. They wouldn't have died. These things could have been detected 10 years earlier.
In fact, as I'm listening to this, I'm thinking, just putting my cult hat on for a second. We have about 1 million subscribers now, and every day about 200,000 people come to our gyms. And every now and then these incidents also happen, when people suddenly find, something on treadmill, they're not able to run and shortness of breath and so on. I think we should think of encouraging all of these people to do annual preventive health checkups, right? It can, because they're at least coming to gyms and putting some effort of wanting to healthy, etc. Which reminds me, you mentioned lifestyle diseases. Now, lifestyle diseases in India were almost unheard of at scale. If you go back 30, 40 years ago, something has changed in the country where we are now acquiring these lifestyle diseases en masse, and that's a altogether different problem also that country needs to think deeply about.
There are multiple reasons. One is the lifestyle itself in terms of earlier when the kids were growing up, kids want to play. And the idea of playing is go out to the field and play. Today, how many times you see kids playing outside? They're all glued to the mobile phone. So the sedentary lifestyle, that's the biggest problem. Then food has become very cheap. Food has almost become like an entertainment. Right? And if you can look at the number of restaurants which have come up, and also the quality of food is modified in a manner, it becomes irresistible.
Right.
So all these multiple factors, lack of exercise, poor diet, right? And also we are genetically 3 times more vulnerable for heart attack than Caucasians. There is and also we develop heart attack at a much younger age. In my practice, it is not the young son bringing the old father for a heart operation. It is the old father bringing his young son for a heart operation. It's very sad. In England, most of my patients used to be retired people. Today, it's the young breadwinners of the family.
And Dr. Shetty, so how does country, deal with this? Because, hospitals or insurance providers are in some ways, they're not able to get people to change their lifestyle or adopt active lifestyle. The, ubiquitous availability of, extremely tasty, but, very unhealthy food is everywhere. And I know you do a lot of work with government, you help with policy and so on. Is this an area where the government can be more proactive?
See, the government will not be able to make a huge difference in this area, but people can. First of all, we doctors have to change our view about taking care of the patient. Today, there are even senior doctors who believe that if you have no pain, no test. That has to change. We have to go on early detection. We may not be able to prevent, but if we can go for an early detection. And amazing things today is that the kind of images what you see out of all these scans is unthinkable. When I was a resident in surgery in India at many years ago. If somebody has a stomach ache, it was not responding to treatment. We did open the stomach, abdomen called laparotomy. The OT list was laparotomy and proceed just to see what's happening. And most of the time you don't find anything. Then you close it and you remove the poor appendix and close the abdomen, right? Today, you just put one ultrasound probe. It gives for minutest details about what's happening inside your liver. It's amazing. As a heart surgeon, what I see with the open heart is nothing compared to what I can see with the ultrasound probe on the chest. These equipments have made tremendous impact on the outcome. But the problem is we are not utilizing it to the way it should be. We utilize it only when somebody has a pain, somebody has a problem. That is too late.
So both among the general consumers as well as practitioners, mindset change. Shift
once a year, it doesn't matter. Like fortunately, Cardiology Society of India has come up with advice to the people that at the age of 18, every Indian should go for a blood test. If the lipid profile and everything, if it is abnormal, then at least they're warned that you have to control your diet and these are the things what should happen. And also the cost of diagnostics has to come down. It should become affordable. Like you go to gym, you should be able to go to a diagnostic center and get everything done in 60 minutes at maybe 3,000 rupees, 2,000 rupees. Then people will go.
And while, as you're saying, technology has improved dramatically, what about indigenous technology in that area? Because a lot of, we rely on a lot of our technology developed elsewhere. We have to import all the equipment. Some of this medical equipment also extremely expensive, which contributes towards the higher cost of testing and so on. Are you seeing, improvement in that area where there's an effort and products that, people are able to bring to market?
You see, I have seen, at my stage of life, when I first started my first heart surgery, the gloves were not disposed of. They were washing the gloves after the surgery. It was now for you to think about, we have come a long way. Now, most of the routine disposables, what we use for healthcare is made in India. Most of the drugs, we are the pharmacy of the world, right? Now, in terms of heavy medical equipments, expensive CT, MRI, we are not there yet, but it's a matter of time. It is a matter of time.
So this is other, medtech is probably other opportunity for entrepreneurs to innovate and, because, and you can easily create, not easily, it's not, but you can create something which is, highly cost competitive and take advantage of an overall low cost setup that we have in India.
See, I'll give you not the medical equipments part. like a digital platform for delivering healthcare. Like the 80% of the hospitals across the world do not have electronic medical records. If you don't have electronic medical records, if you are writing on the paper, there is no way healthcare can become safer. It is very difficult. We have to abandon the paper and embrace digitization. So medical error will come down, but 80% of the hospital can't afford it. So we decided 20 years ago to build a digital platform. We have spent huge, more than 500, 800 crore rupees on building the digital platform. Now, about 16% of the heart surgery done in India is done by us. We need this platform. Around a couple of years ago, we decided to give it to all the charitable hospitals free of cost so they can use it. Around a few months ago, one of the charitable hospital I gave, my idea is that any hospital, who doesn't have it, who can't afford it, they can have it free of cost. So one of the hospital promoter, the CEO visited me and he wanted to thank me for giving the software. And he asked me a question, why you gave it to us free of cost? Then I told him, if I ask you to pay, you won't have the money to pay, I gave you free. But then I asked him another question. I asked him, you asked me the software, I gave you free of cost. Have I become poorer? No. Then I told him, I'll ask you another question. If I didn't give you, will I become wealthier? No. This is the beauty of converting atoms into bytes.
Right.
We would have spent huge amount of money. We want to give it to all the 80% of the hospitals across the world and use it. And if they want to pay, if they can afford to pay, let them pay. Because I'm not going to become wealthier or poorer by not giving it. So let them have it. So converting the beauty, converting the atoms into bytes will have a major impact on everything what we do. Cost of everything will gradually go down.
And you were quite a pioneer in starting digitization. I've been to Narayana, recently. I noticed pretty much everything is digital. I don't see any paper in the hospital at all. Which is, I don't think there are many places in India which are, fully digitized. And I think that's as you're saying, the power of digitization, its distribution can be much larger. And of course, a lot of intelligence come in. We'll come to AI in some time. But that's, being able to just digitize everything, both about the medical operations as well as what's happening inside one's body.
Exactly.
And, being able to then we'll be able to do outstanding things, leveraging AI in future. So that's probably, again, an area where needs to be significant push. And glad to hear that, all the assets you built, you are at least making it available to all the charitable hospitals around the country. I think it's a great service. So always, I think you've been the health, Narayana is a very successful, large business, but the spirit of giving has always been there from day one. And you continue to, I think, champion that now.
We are lucky. We are lucky to be in a position to...
No, I think, you are also very modest in addition to...
These are important, Mukesh. See, today everybody is talking about the AI and AI transforming healthcare. If you don't have the basic electronic medical record, if you are still writing on paper, how can AI work? Everyone talks about fancy vehicles, but nobody is building the road. So we thought we'll build the road, then people can build all the fancy tools.
And having built all the roads, have you started looking into AI seriously and you think about how it will transform?
We have about 50 software engineers who have been working on AI for the last 10 years. See, today people talk about AI after the chat GPT. But 10 years ago, we could get, our team created the risk score in the ICU when the patient is there. What are the chances of them developing a cardiac arrest and all these analytic tools? We had it many, many years ago.
But is this, now, the AI is a headline news nearly every day. There is a lot of people go to GPT and, upload their reports and ask for inputs and so on. And this is not so much about what's now, but the technology is also now improving at an exponential pace. So how do you foresee, not only Narayana, but overall healthcare in general for the country, the role that AI can potentially play to bridge the gap between haves and have-nots?
It will have a massive impact. Technology, AI will have a massive impact. Now, it will not replace doctors, but it will dramatically improve the productivity of the doctors. A diabetologist who today may be able to manage 3,000, 5,000 patients, with all these tools, they will be able to manage 30,000 patients. That's the first thing. Then it will prevent doctors from making mistakes. All these things will dramatically improve the productivity of the healthcare.
Right.
And make healthcare safer for the patients.
Right. And will this, ever since I have studied Indian healthcare, one of the things that come on very early is the massive shortage of doctor. This 1 million number is quoted at many places.
Yes.
With, AI going the way it is going, do you think that shortage in some ways becomes less important, or we still need to upgrade our infrastructure to train a lot more people? I think you have talked in a lot of places that we need to create, 100,000 or more medical seats in the country.
Yes.
How does, that requirement stays?
We need 10 times more than what we have, based on many issues, many reasons why, especially country like India. First thing is, celebrating 95th or 100th birthday is going to be the norm. It's not going to be an exception.
Yeah.
Now, when people live past age of 80, 90, they will go in and out of the hospital. They may land in the ICU. In 3 days, they get better and they go home.
Yeah.
Somebody has to be there to take care of them. So because of the longevity, there is a need for more doctors. And more than that, the developed country, rich countries, youngsters don't want to become doctors. They don't want to become nurses.
Yeah.
So we have a unique opportunity. We produce over 25, 26 million babies a year. The jobs what we have, simply we cannot give jobs to all of them, meaningful jobs.
Yeah.
But if we convert all our youngsters who have a passion to become doctors, nurses, give them an opportunity, it will have a massive impact. I'll give you an example. In Cayman Island, we have about 100 or 150 nurses working with us. Most of these nurses send home every month 1 lakh to 1.5 lakh rupees.
Really?
And they're only in their 23, 25, 26 years old.
Amazing.
These girls come from a real poor background from northern Karnataka and rural Tamil Nadu. And they are able to earn that kind of money. Which profession today, a girl from a poor family from rural India can afford to send home 1.5 lakh rupees? This is the power of healthcare industry at an early stage. Pays you disproportionately higher than other industries. But then, as a national policy, we should really look at, when we make healthcare policies, we shouldn't look at what is the need for India. We should look at the global requirement. Right? See, there was a study conducted by Harvard Business School with the medical school, which shown clearly in US, Americans who are treated by expat doctors, mainly Indians, lived longer than the Americans who are treated by American doctors.
Okay.
We are genetically, we are designed by God to be healers. So we have that advantage.
Caring is in the culture.
Caring and compassion is part of our life. And that's what is required in this
I
industry.
think you're making some very powerful points, Dr. Shetty. It's just, we obviously have in some way surplus of population, not that many jobs. We have shortage of, medical professionals in the country, but the world has even bigger shortage and world has the ability to pay. In America, 20% of GDP is now healthcare.
Yes.
And, we have exported, a lot of software engineering in the past.
Yes.
But perhaps, the healthcare industry could, and that, in some ways, participation in the global economic value chains and generating income and opportunities in the country. Is that progressing? Are we able to create more medical seats?
Yes. Our government has made a commit. Prime Minister in his speech, he has mentioned that we'll be adding 75,000 additional medical seats in the next 5 years.
And currently we are at about 100,000.
We are 110,000. We have, in the last 10 years, we have virtually doubled the number of medical seats. And now they want to add another 75,000. Tell me, is there a single country in the world which can say that we will add 75,000 additional medical seats? They don't even have 10,000 medical seats, most countries.
Right.
So we are a very privileged country.
Yeah.
We have a unique opportunity.
Right.
Yeah.
And I think I can almost say also is probably this industry will continue to be in some ways AI proof, because the human touch, human warmth, compassion
It is always there. Yes.
Right.
Yes.
So that is a safer profession. So it takes a lot of effort to become a nurse or a doctor, but probably a safe option for people to consider. Just I want to, one of the areas we didn't touch upon, but I think you have also pioneered a lot of processes. It's not easy to provide, to bring world-class cardiac surgery and other, specialties at an affordable cost. So we've been like tinkering a lot with the processes, how doctors are trained, equipment usage throughout, 24 hours. So just a little bit, give some color on that and your approach in optimization. It almost seems like, Henry Ford, optimizing assembly line to bring out, really affordable car that everyone can, aspire for. I think in many ways you have done that in Narayana without compromising quality, but yet through process innovation, you brought down the cost significantly.
See, India is a very unique country. We defy a lot of logics. And more than our story, I'll just give you what happened in India. I will talk about one surgery which most of us will go through in our lifetime. That is cataract surgery. When you grow old and reach certain age, you need to go for a cataract. Most people need it.
Yeah.
Now look at 3 countries. Look at US, China, and India. USA does 3.5 million cataract surgeries a year to cover the whole population. China is 4 to 5 times bigger than US. They should be doing 4 to 5 times more. China is doing 3.2 million cataract surgery a year, less than US. Why? Because there is no entrepreneurship in healthcare in China. Hospitals are owned and managed by the government. That means most of the old people in rural China cannot see. And they haven't seen anybody who had a cataract surgery. So they don't know that a cataract can bring back the light in their eyes. Yeah. Come to India. India does 8.5 million cataract surgeries a year. India does more cataract surgeries than US, China, and most of the European countries put together.
Incredible.
Now, the question is how India did it. See, this is what the power of India is, which everyone should know. 30 years ago, ophthalmologist, eye specialist in India got fed up of big Indian hospitals. They said, "You're too expensive. Our patients cannot afford you." They walked out of the hospital. They went to communities. They rented small houses. They converted the ground floor of the house as their clinic and the operation theater for cataract surgery. They lived in the first floor. Whenever they had a cataract surgery, their wife assisted them. They brought down the cost of cataract surgery to a level anybody can afford. Today in India, you don't find a single person who's blind due to cataract. It's a magical transformation. You go to Western countries, rich countries, see what is the waiting list for a cataract surgery. This is what this country is able to do. This is what will happen in every aspect of healthcare. Diagnostic, surgeries, everything will undergo dramatic change. And that change will be brought about by entrepreneurs who look at things differently.
This is genuinely magical, and I think
it is nothing short of magic.
A lot to look forward to, because this is one area where we are able to not only match but exceed Western standards. In the example of cataract, right? And I lived in the US for 10 years, and it's very painful to even get an appointment. Where it's just so easy. I think some of my friends who visit from US to India, they take care of all their health needs while they're here because it's so easy and affordable and world class. So it's without compromise of quality. Yeah. I want to go back to my last question, Dr. Shetty, on you earlier talked about it become a norm for people to celebrate their 90th, 95th birthday. I was, if you don't mind me sharing, you are 72 now and very active. You maintain a full day, you spend time in operation theater, you are involved in, all kind of giving back to society, government and so on. So maybe two-part question, just your own approach to, staying engaged and productive at this age and, maintaining a full schedule. And what is also that most people who will earlier used to think 60, 65 is a retirement age, how should they think about a life which is maybe extra 20, 30, 35 years, they may have, post earlier retirement age.
Let me talk to the youngsters. Okay. First thing is you should enjoy what you're doing. Then it ceases to be a job, right? You tap down through work.
Right.
So that's the most important thing. The second thing is, whatever you do, you try to be the best in that.
Yeah.
So put your heart and soul to it. Yeah. Always thinking and doing. And for me, every day, and when I finish my day, I want to be better tomorrow than what I was previous day.
Yeah.
Everything what I do, I want to do it slightly different, something different, something better.
Yeah.
Some of them work, some of them don't work. But at least I have tried it.
Yeah.
More than anything else, it is very important for all of us to, first thing is take care of your health. That's very important because if you don't care for your health, so I obviously the simple thing like not smoking, drinking, these things, it does help. But exercise is very, very important. So I am a very fanatic of, when I was a young man in the medical college, I used to win prizes for Mr. KMC, Mr. Medico, and karate and all kinds of things. I used to be involved. And I still practice yoga. And I believe that yoga is the best gift given by our country to the world.
Yeah.
Because it had an amazing impact in my life. Around 8 to 10 years ago, I started getting pain in my knee. And my wife started telling me that, go do some yoga, you will get better. And I said, I always thought yoga is for very old people, not for me.
Right.
But the pain became so bad, I couldn't. Then one day I asked somebody to get a yoga teacher to come. And just 3 months, I forgot where the pain was. Today, if you ask me whether it's a right leg or left, I don't know. My life has never been the same, right?
Yeah.
That's very important. The more than anything else, you need to be spiritual. Yeah. Surgery is a very stressful procedure. You're taking someone to the brink of death and bringing them back. It can be very stressful. But when you think yourself that you're like in my hand, I have surgical instruments. Like if I think like in the hand of God, I'm an instrument. I'm just carrying out what He wants me to do. Then the whole approach for life changes.
Right.
When we go through the stressful period, when you have problems, if you just think that there is someone up there protecting all of us, it will be a biggest soothing and comforting power. I'm not saying you should be religious. I'm not religious. I am very happy to go to church or a mosque or wherever and pray. I have no problem. But you need to be spiritual. You need to believe in the presence of God.
Yeah, you have a very positive and optimistic outlook to life, and the sense of giving back. I think what you say is about tap dancing to work. I think that's a great phrase for people to remember. I want to thank you, Dr. Shetty, for first of all for the incredible work you've done. I think your work is really inspiring. I think countless lives you would have touched through your work in a positive manner, and also set a role model for many other people to emulate. Inspiration for a lot of entrepreneurs. So thank for everything you've done for the country, and also thank for taking the time
Thank
speaking, with me.
My privilege. Thank you very much, Mukesh, for giving me this opportunity to interact with you.
It's an honor, sir. Thank you.
Thank you.
At SparX, we aim to bring to you stories of exponential impact. We share in-depth analysis of what goes behind success stories. If you find our conversations interesting, you can join us by subscribing to our YouTube channel. You can also listen to SparX on Spotify, Apple Podcast, or any other audio platform of your choice. If you have any suggestions on who we should invite or what topics we need to cover, just let us know in the comments. We are always listening, looking for ways to improve, and keep getting better as we go along.